Military families have incredible stories of perseverance while navigating frequent moves, deployments, food insecurity, transitioning out of the military, and more. This is the place for them to share those stories, highlighting unique experiences of military families. Welcome to the Professional Dependent Podcast. Samantha, so like you just said, I was introduced to you through Maria. Um,
Mhm.
Last week I had the pleasure of interviewing Maria. That was the first time that she and I have ever actually talked face to face, Zoom to Zoom, whatever. Um, we've had a few correspondence over social media because I've been following her moving with the military stuff for a very long time. And she was like, you know what? I have somebody you've got to meet. Her story needs to be shared. So why don't you introduce yourself?
Well, first of all, Maria's amazing, and it's
Agreed.
always incredible to have friends who talk you up when you're not even in the same room. So I definitely cherish her. Um, my story is that I am a military spouse. I've been married to my husband Mike for going on 19 years. We have three kids, a 15-year-old, a 10-year-old, and a 7-year-old. And I'm employed as a PA. I work with Maria with our nonprofit organization, the Inspire Foundation. And she and I met back in 2019 when we were both military spouses of the year for our respective military branches through the MSOI program, where we met Jessica as well. And life is good up until April when Mike was gone and I was starting to have some vague symptoms and ended up getting diagnosed with ovarian cancer. So that was a huge kind of wrench in our plans this year. So I've been trying to navigate life with how that looks now, undergoing treatment. The buzz cut is not for fashion. It's my hair growing back in.
Like it's not because it's hot, it's because I shaved it off. And so
Yes.
and so this the reason why like Maria and I both kind of agreed that we wanted to get you on my program was because this is Ovarian Cancer Awareness Month. Is that correct?
Yeah,
Yes. And
it is.
so
And foolishly, I didn't even know that up until I was diagnosed with ovarian cancer. So I guess it's just paying attention to what's important to you. And up
right.
until this, it just wasn't on my radar.
Right. And that's the thing is like it's one of those, like if you don't if it doesn't affect you personally, you have a hard time paying attention to like I knew it was Suicide Awareness Month because
Mhm.
they always tend to stack the different things on top of each other. But so I honestly did not know that it was Ovarian Cancer Awareness Month until my conversation with Maria. And I was like, well, then absolutely, this is the perfect time to make sure that the story gets out so we can help spread awareness. Because I was looking up I don't know if you've looked up the stats on anything. I've looked at the stats a little bit, and they're
Yeah.
not good.
No,
Um,
they're actually quite,
yeah.
yeah.
Um,
Um, so you're going off the NIH numbers for 2023. I believe, and I'm just pulling from my brain, it's 19,710 women are going to get diagnosed with ovarian cancer this year. And
mhm,
of that, I believe 13,270 are going to die. So it's about, I think, a 50% survival rate.
mhm,
And that's overall stages 1 through 4. But it's
right,
scary because typically ovarian cancer is not detected until it's in a later stage where it's already metastasized.
right. And you with your I mean, you being a PA,
Hmm.
which for people that don't know, it's a physician's assistant.
Yep.
Um, so you have medical training, like you're trained to talk to people about these signs and symptoms, but from listening to your story, been following you on Instagram for just for about a week now, but like kind of going through your story, like even you were like kind of pushing off your symptoms to the side because you're like, no, it's really not that big a deal.
I didn't think it could happen to me. And
Mm,
I said in one of my stories, it's arrogant to say that, but I consider myself young. I'm 42.
mhm,
I was healthy. I exercised. I was busy to the max when my symptoms started, probably early April. My husband was gone. I was working 2 jobs, 65 hours a week,
mhm,
shuttling the kids around, dealing with what they had going on in their world. And I simply didn't have time to be sick. It never
mhm,
even occurred to me. So when I started feeling my scrub pants getting tight and I was gaining weight, I really started to chastise myself. I'm like, oh, we're
mhm,
eating out too much, or got to lay off the McDonald's, or I need to make better choices with my coffee creamer. And I bought, so embarrassing. I bought this bodysuit on Instagram that gives you a snatched waist, because I was like, dang, I was in the best shape of my life in November.
Right.
What is going on? Why is my belly swelling like this? And I probably wouldn't have gone to the doctor for the symptoms alone, which were change in bowel habit, abdominal bloating. My son was getting tutoring for math during the week, and it didn't seem weird to me at the time that I was sleeping at the library during his tutoring. I just thought I was exhausted from the week. Now,
Right.
looking back, fatigue is a symptom of ovarian cancer. And all these are so generic. They could be a million different things with a differential diagnosis. And we had gotten kayaking on our property, and my son, who's stronger than me now, we were carrying kayaks back to our warehouse to put them away. And I swear I pulled my hamstring. I just had this leg pain. I was limping around for a week, taking Motrin, thinking it might've been my sciatic nerve. And it was Mike got home on Sunday. Wednesday morning, I was kind of feeling around on my belly when I was laying in bed before I got up, and I felt a mass. And the mass was about the size of my fist, right below my belly button. And it was hard. So I woke Mike up and I had him feel my stomach, and he looked at me. He goes, "You're scaring me." He goes, "What is that?" So I go to work, and I grabbed one of my friends who's also a PA, and she worked in gynecology for years, and she did an exam, and she looked at me, and this was a Wednesday. She was saying, "You need to get to the doctor today." So when I go to work, I'm seeing 37 to 40 patients a day. And these people have taken off work or gotten babysitters or rearranged their schedule to come see me. So you don't leave work very lightly. But I had called my doctor, and they didn't even want me to come into the office. They sent me right for abdominal imaging that morning. So they canceled my schedule, and I went and got an ultrasound, and the ultrasound demonstrated an 8 centimeter tumor on my left side, which was then confirmed to actually be a 16.5 by 14 by 8.5 centimeter tumor when we got the MRI later, which is wild. And through social media, I put a post up. My doctor had told me that it was cancer until proven otherwise. And a sorority sister got me an appointment with my oncologist. I saw her on a Tuesday, and she said, "What are you doing tomorrow? Let's do your hysterectomy." So that day, after we left her office, I went for pre-op testing, and she had called because I told her about my leg hurting, and she added on a Doppler, and that's where they found 2 blood clots. I had 2 DVTs in my right calf. So the morning of my hysterectomy, I actually had an IVC filter placed. And then from there, they rolled me in for my radical hysterectomy. So all this happened from the day that I found the mass to the day I was on the OR table was 7 days, which is wild.
That is insane.
Yeah, it happened very, very quickly.
That's not even enough time for you to begin processing what if anything's going to look like forward. That's barely enough time to register what's going on.
I don't think I did, because so in the beginning, from when they found the tumor to when I had my operation, we knew it was very likely cancer. I was also dealing with leg pain. So in the quiet hours, Mike and I would get up at 3:34 in the morning. I just couldn't sleep. I was almost certain that the leg pain was bone pain and it had metastasized. And what was so shocking to work through is that we've been through countless deployments. I know how that goes. So what happens if Mike gets killed? I know where he wants to be buried. I know what he's going to be wearing. I know who's going to carry the casket. We had never in 19 years of marriage talked about my own mortality. And in those early days before the cancer was staged, I wasn't sure if I was going to see the first day of school. I wasn't sure if I was going to be around this Christmas. And the weight of that and trying to wrap your brain around that, I just went into almost like a deployment checklist. So we found her on Friday. I had our family photographer came over. I updated our family pictures. I ordered the Build-A-Bears with the voice recorders. I just went down the line of what we normally do during a deployment to get ready when daddy leaves. But this time it's still hard. I don't think I've really worked through everything yet, because it's just been at the end. I think that there's a lot of healing that needs to be done.
I mean, because even just listening to you go through that, like, because so my wife and I have been together for just over 19 years. It'll be 20 years this summer.
Hmm.
Um, and her being medical, we haven't been through a lot of deployments. She's deployed 3 times. Two of those were back to back. Just matter of fact, just last year was her third. So like, a lot of what you're saying, like, we think about stuff from their end of, okay, well, these are the things that we go through. These are the things, but we never, like you just said, we never sit back to think about, well, what if something happens to me? Because
Yeah,
like you said a minute ago, like we don't have time to be sick or tired, or when our spouse is gone, we have to do all the things.
all the things. Yeah, we go into survival mode, and certainly if it's for the kids, even for people, say who are PCSing, you're going to
Mhm,
get your pediatrician set up, you're getting the school set up. You setting up your own primary care physician
mhm,
is never really at the top of the list. And you have these, I should go get my mammogram, I should get my dental
mhm,
appointment, I should get my yearly skin exam. But we don't have a sense of urgency with
mhm.
those for us.
Right.
And I think that's something that needs to be talked about as well, because there's so much value in preventative care and early detection
Mhm.
rather than reactionary medicine, when the prognosis could be wildly different for a number of different diseases, not just ovarian cancer.
So if I understand it, like, so your husband Mike, he was deployed whenever you first started having the symptoms,
Yeah.
right?
Mm-hmm.
So, and like in my head, I mean, me like I understand why you were like, no, this isn't important right now. Like, let's not do. Okay, we're all going out to eat too much, because I can. That is something I can completely relate to. But then and then as soon as he comes home, you're like, oh crap, now this is way worse than I thought. That is just the way military spouses operate. Like, we don't ever take the time to think, no, I am just as important to take care of myself. It's just as important to take care of myself
Yeah.
as it is to take care of those around me.
Mm-hmm.
And like you just said, the preventative side of things, you know, we're not going to sit here and talk about what ifs, like, because there's no point in doing the what ifs, but you potentially could have caught it a little sooner. But I understand why. Like,
Yeah.
I fully
Mhm.
understand. And
And I think that system, looking at the system within my home of
Mhm,
how, not that I allowed it to happen, but there's a lot of retrospective
mhm,
analysis. How long was it there? I mean, I look at the Christmas pictures we took last year, and I look at, did I have a tumor then?
mhm,
Or, our anniversary pictures or my daughter's birthday. You go back and you go, what could I have changed or done differently? What I think is a hoot is I posted on March 25th that I went for my mammogram, and I was in
mhm,
my little gown and I had my flower and a negative exam. I had a huge tumor in my abdomen,
mhm.
and I was going for a mammogram. Like, I went for the completely wrong test. It's just
Right.
very ironic to me that I was doing those testing, not even knowing what was brewing at that time.
Yeah, especially as a PA, you sit there, you're like, it's and I say this almost to try to be funny, like, you're like, dummy, if I'd have done this instead of that.
Yeah.
But if we sit here and try to look in hindsight, I mean, you're just going to beat yourself in the head, because there's no point. Because like I said,
But
you can what
that,
if a death.
I mean, but those are the thoughts that creep in at nighttime, right? So the
Right.
what if. And my background, I work in dermatology, but I spent years in GI, and that was
Hmm.
my GI office is wonderful. And I was covering for a nurse practitioner that was on maternity leave. So I was working back there, and the symptoms of constipation, bloating, changes in appetite,
Hmm.
that just seemed so obvious to me that it was of a GI origin, and I wasn't
Right.
really considering gynecological cause. But what haunts me is how many females have I treated for those
Mhm.
same symptoms with that GI mindset? Where did I miss an early ovarian cancer on them?
Mm.
Should I have done things differently? And what's scary about ovarian cancer is there is not an established screening technique for it, period.
Right.
So ultrasound is not a screening measure. CA
Hmm.
125 blood levels is not. Even a pelvic exam, depending on the position of the uterus,
Hmm.
may not detect a mass on the ovaries. It's just wild. And that's why it's the silent killer, because by the time it really manifests symptoms,
Hmm.
usually at a later stage.
So I wonder. like how, man, I wonder how we could fix that going forward. Like, is it, you think this is better education, women speaking up for themselves, more like, no, I really think this is something different than what you're saying?
I think there's power in patient advocacy,
Mm-hmm.
meaning knowing your body and
Mm-hmm.
knowing when off, but also standing your ground, because I I'm in a unique spot of privilege that I am the patient now, but I've been the PA. And a
Right.
PA, even if you're an excellent provider, I know I have, say, 37 patients that I need to see today.
Mm-hmm.
I have 15-minute slots. I'm double booked at the top of the hour. You go through
Mm-hmm.
the business side of things. Whereas a patient, I would encourage them that if they feel that they are not being listened to, or if their concerns are not being investigated to where they are comfortable with the outcome, then they need to keep pushing. You need to get a
Mm-hmm.
second opinion. You need to go back to the doctor, because constipation, I would initially treat that with increased fiber, increase, your water consumption, try a little Miralax, see you
Mm-hmm.
back in 4 weeks. Whereas a patient, if you go, you know what, I did those things and it's
Mm-hmm.
not working, we need to do something else. You have to be able to push, because I'm learning that there's very large gaps in the medical care
Mm-hmm.
on the patient side. Even with the best providers, um, there's gaps, and it's shocking. It's shocking to me on what I've gone through so far. So I think that people need to know their bodies and not
Mm-hmm.
to give up.
I know. So speaking about taking up for yourself, I I'm one of those people that because I like to power lift and because I was an endurance athlete for so many years, I know my body pretty well. I
Mhm.
know whenever things aren't, and I try to keep up whenever people are telling me things about, okay, this is what this is what that is. So, being a military spouse with military medicine, whenever you change locations and like you have a great rapport with this provider, and either they PCS or you PCS, and now you've got to build that rapport back up. That provider doesn't know you. And like you just said, that provider's got 15
Mhm.
minutes before they've got to be at their next appointment. I can remember distinctly being in Georgia when we first got to Georgia, and because of my blood pressure, I have to do yearly blood work, all the fun stuff. And they're like, "Oh, your creatinine levels are high." I'm like, "Well, if you go back and you look back in whatever years that I had to do a 24-hour kidney thing, and they had to do all this stuff because my creatinine levels are naturally high." And she was
Mhm.
shocked that I was able to like almost cite chapter and verse. And because of that, she was like, "Oh, well, then we'll just press on from there," instead of being like, "No, we got to focus on this one thing," because I actually did know
Yeah.
my medical history. How much do you think? I wonder how much people miss and they don't understand, because I usually tend to give our providers a lot of grace because of a lot of what you just said. Because you're double booked,
Mhm.
you've got patients every 15 minutes. And I know from my side of it, I see a lot of people complain, "Oh, well, it's impossible to get appointments," but they're booked so much, and and I don't know if it's because are y'all with DHA, or are you off base?
We don't have a base here. So
Okay.
we're living a military life in community. Mhm.
Oh, right on.
So I work with a private practice.
And even private practice is booked, you know, basically what I'm trying to get, like, the workload for providers is nuts. And so I
Yeah.
wonder how much
And
gets missed because of that.
I mean, the medical model right now is broken, and I'm not
Mhm.
going to be the person to have the answers.
Right.
Uh, I think that when we're trying to figure out advice and we tell people to know their bodies, that's just
Mhm.
a small piece of the pie. But
Mhm.
I think that that's what we can control. Even when I'm at work and I feel that my patient needs a CT scan of the abdomen
Mhm.
or an MRI, most times insurance will deny it, and they want to ultrasound first, or they want me to have to get on the phone and do a peer-to-peer consult with somebody who
Mhm.
doesn't even work in that field, and I have
Right.
to plead my, but that's not efficient use of time all the time. I can't do that for every patient. I can
Right.
do it for the ones that I think really need to be fought for, but it's a broken system. And that's why I agree with you. There's such a disservice to military families because you're not having that continuity of care. You have to have that burden of proof where you're explaining your case. You're like, yeah, my creatinine, we've already done this.
Yeah.
But for someone who wouldn't have that savvy, you're starting from square one, going through unnecessary testing and maybe not even picking up on something that should be because your focus isn't in the right place.
Man, that is and I always try to be very careful whenever I start talking about medical stuff because I do know a lot of providers. Like I have really good friends with a lot of military providers, and I know there's such a stigma with military medicine. And I remember, this is a little off topic, but talking about whenever we were at Little Rock, and my wife was actually working in the clinic as public health. I would go in to visit her, or take her lunch, take her coffee, take her something. They had a board up by the check-in office for whenever people come to check in for their appointments, that showed how many no-show appointments they would have every day.
Yeah.
And every time I would see people complaining about how hard it is for them to get appointments, especially spouses, I would go to the med group and I would take a picture of that, and I'd be like, this is why it's impossible to get appointments, because people have appointments and don't show. And that's just part of it. But I mean, that's part of the problem as far as like the whole totality of things. But anyway, I get off on tangents sometimes. So your husband comes home, you get tested, and 7 days later you're having surgery.
Yeah. So I had, they couldn't do it laparoscopic because the tumor was so big. Vision from my belly button down to my pubic bone. And they took my ovaries, my fallopian tubes, my uterus, lymph nodes, and my omentum, which is the fat layer that covers the intestines. And then I was started on Eliquis, the blood thinner for the blood clots, ended up needing a blood transfusion. The course and surgery has been tumultuous, to say the least.
Yeah, I mean, that's not just that's an everything evacuation. That's not just like go in and take part of it. That's like, we're taking all of it out.
Yeah, everything. I'm lucky in that it was a stage 1C. So the was limited to my left ovary. The C letter afterwards means that the capsule was compromised. So the capsule around my ovary was broke when they removed it, which is why I needed chemotherapy, because they were concerned about surgical spill of those cells into my abdomen, where we want to decrease any risk of reoccurrence.
Right. I mean, that makes sense, because if it wouldn't have been compromised, then you probably wouldn't have had to go through chemo. Do you think they would have done chemo as a preventative anyway?
No, if you're going off of, because there's an algorithm for everything. So if you're going off the algorithm, if it's, I believe, a stage 1A or stage 1B, monitoring is appropriate.
Gotcha.
Stage 1C, and it's really up to the provider discretion. You can pursue chemotherapy or you can monitor. And not that anyone would volunteer for chemotherapy, but I'm young. I have 3 kids. I want to live for a very long time. So I was prepared to push for chemo if my doctor had wanted to monitor. But she's amazing. I call her a chemo cowboy. She was like, girl, we're going to do this. You're going to be fine. And we make sure that you are around for your kids. I was like, okay. So
a lot of that changes whenever we start thinking about what do we want to do for our kids. And a lot of there's a running joke that I've seen a lot lately, is people say, well, I would die for my kids. Like, well, are you willing to live for them? So it sounds like you chose the latter. You're like, no, I want to be here for as long as I can. So that's,
I mean, a lot of what we didn't touch upon is that I'm BRCA2 positive. So after the hysterectomy, we did the genetic testing and we found out that I BRCA2 carrier. And that changed my perspective, because I have family history of ovarian cancer and breast cancer. For myself, they've been asking me for 10 years, get the genetic test. In 10 years, I mean, when you think back 10 years ago, the world was different. And what are they going to do with information? How can they use it against me? Will I be discriminated against, or what, right? Now, I could have potentially passed that gene down to my children. So
Mhm.
now I know that I have to save myself so I can save them.
Mhm.
And just being knowledgeable about screening procedures and how to manage this going forward when they are adults. So
Mhm.
it's giving me that source of passion that no matter what, I have to continue fighting.
Now you said the BRCA2, that is the genetic marker that kind of like lets people know you have this predisposition, correct?
Yeah. And then when I was tested, it wasn't just for the BRCA1 or 2. I think
Mhm.
there's like 26 different genetic testings that they
Mhm.
do for different mutations. The one that I have puts me at risk for up to a 40 to 70% chance for breast cancer.
Mhm.
The ovarian cancer, I already checked that box. Pancreatic cancer, melanoma, and for men, prostate cancer as well.
Mhm.
So I had the hysterectomy. I have elected to go through with a double mastectomy in December.
Okay.
And then I'm established with a pancreatic specialist that we're doing yearly monitorings to make sure I don't get to that point of cancer.
Gotcha. How did you find out about the genetic testing? And that was even, I mean, was it something that you knew through PA, or was it somebody that recommended it to you and you're like, okay, yes, since this has already happened, why not go ahead and do this check all the rest of it?
So I knew about it from PA school. My gynecologist, when we were stationed in West Virginia back in 2013, started encouraging me for it.
Mhm.
When I was done having children, she wanted me to have a hysterectomy, but I was 35 years old. Who
Mhm.
volunteers to surgical menopause when you're 35?
Right.
That's I have now come to regret that decision that I did not pursue that. But when I talked to Mike about that guilt, he said, Sam, you did the best with the information that you had at that
Yes.
time.
Yes.
No, going back. But then after I declined each year with my gynecologist, the oncologist was like, we're doing this,
Mhm.
it's strongly recommended so that we know how to treat you going forward. And by that time, absolutely draw whatever you need. I want to know all the things so I can prepare myself.
Right. Yeah, because at that point, you're like I've already gone through this. Like, let's get ahead of the next thing. Like you just said, preventative side, right?
Yeah, and you don't have to have a double mastectomy.
Mhm.
They can do monitoring with mammograms, alternating with breast MRIs every 6 months.
Mhm.
But I've had so many friends, people that I follow on Instagram,
Mhm.
who have died. I've had 3 this week.
Mhm.
And coming off of, I have my last chemo scheduled for next Tuesday. I don't ever want to go through this again.
Right.
So if it means, going forward with a surgery, that was the better choice than always waiting for those results of the scans every 6 months. Is this the time that it's going to come get me? Is this the time that we need to take action?
Right.
So preventative.
Yeah, is that because again that goes back to the doing everything you can to make sure you're there for your kids, because if your oldest is 15, you got a long time to be able to be around and harass them as they get older. That,
Yes.
that's what I keep telling my kids. I'm like, look, y'all are stuck with me for as long as I can possibly be here, because I have who else is going to harass you like I can.
Hmm. Absolutely.
So what is so you do the Inspire Up Foundation. The Is there another organization that you're a part of with the ovarian cancers as ovarian cancer, or is it just Inspire Up?
Um, so definitely Inspire Up, and that's also formed with Jessica Manfrey. Um, and that formed from Giving Tuesday Military, which we
Mhm.
started in 2019, and we have an amazing director of that program now, Brittany Rains. I have an organization with my husband here, Project 33 Memorial Foundation. So we
Mhm.
started that in 2018. And that's something that we do every Memorial Day to honor the lives of special operations soldiers killed in action since 9/11. So we have a local run,
Mhm.
also virtual runs, which has been incredible. As far as the ovarian cancer involvement, there's some really great national organizations, the NOCC, OKRA, which is the Ovarian Cancer Research Alliance. And I looked at getting involved with their Survivor to Students program. So
Okay.
they take ovarian cancer survivors and you go to medical schools and you speak about what your experience is to try
Mhm.
and change the next generation of providers or
Okay.
inform, have awareness. I haven't been able to participate in that yet, just because I'm going through treatment. And for example, this week my counts are down. So I've had to cancel every social engagement that I thought I could have, because I just can't risk infection. But that's
Right.
something that I do going forward. And right now I'm working with the Pink Warrior Angels, which is a nonprofit based out of Texas for ovarian cancer awareness. So I'm one of their ovarian cancer ambassadors right now. So really, I'm the crazy lady on the internet trying to make some about something that totally blindsided me, and to give other people, a fighting chance. And this may not even be information that you need, but you may have a mother, a grandmother, a sister, somebody where you go, you know what, you better get that checked out. And through that word of mouth just might save some lives.
See, and I know, like what you just said, like some people are going to look and be like, why is this dude, interviewing about ovarian cancer? Like, obviously, I don't have ovaries, but I have two daughters. I have a wife. I have, and on top of that, like some, people that are in my normal audience, maybe they have a female spouse, or they have, daughters or a mom, and they're going to be like, huh, I never thought about this. Hey, is this a thing? And
Yeah.
then maybe they can just be like, hey, you've been complaining about this, so if this gets out and helps like one person, then this is absolutely the right place for this interview. Plus I'm having an absolute riot of a time talking to you.
Been powerful, the number of messages just from people that I have on my Facebook page or whatnot, saying, because of what you said, I called my doctor. Because of this, I went to go checked out. And two, it gives me goosebumps. Two of my friends went for testing and actually had breast cancer. Just because we talked about urgency with following through appointments or getting your mammogram done. And when you really sit back, wow.
Yeah. Wow, exactly. Because that's two people that that may push something off, but you're like, no, these things are important. It can quite seriously save your life. And they're like, okay, fine, I'll go do it. And then, holy crap, okay, thanks.
It's bananas. And my husband and men and women in general, some things are embarrassing to talk about. I worked in GI. People hated talking about rectal bleeding. People hated talking about diarrhea or things like that. And those are words that just kind of roll out my tongue because I'm uncomfortable. But the stakes are so high, not only with ovarian cancer, but say colon cancer or different things that might be a little bit more intimate to talk about, that I would just encourage people just to be, 15 seconds of brave. Just be brave for 15 seconds. Pick up that phone, make that appointment. A good provider will make you feel absolutely comfortable, and get checked.
Yeah.
That no fun. No fun at all.
No. And like you said, it might be embarrassing or uncomfortable, but the alternative is significantly worse than being a little embarrassed to say, hey, I've had a lot of rectal bleeding lately, and it's just not normal, and it's not from taking too much Tylenol. Like, it's a little bit better to be like, can we get this checked instead of waiting until something's too late and now there are no alternatives.
Exactly.
Okay, so I want to talk a little bit also about Inspire Up, because Maria mentioned it because of the Giving Back Military Tuesday, which she talked me into doing it. I'm an easy sell. Like, she was like, hey, we do this thing at Tuesday after Thanksgiving, and I'm like, say less, I'm in. Like, she didn't even get a chance to really like fully explain it to me. I'm like, I'm in, whatever. So why don't we talk a little bit about Inspire Up?
Yeah. So Inspire Up was actually birthed from the Giving Tuesday military movement. And in 2019, we were in a conference room in Kansas where Jessica had pitched to us, let's give back. Everybody always does nice things for the military community. What if we flip the script? What if the military community spreads kindness to the civilian world? And of course, we're like, yes, we're in. What's going to be our goal? So in 2019, our goal was 1 million acts of kindness, which is insane because we were 3 military spouses. We had
Uh-huh.
only met in person twice by that
Mhm.
point, just really developing our relationship over Zoom calls and FaceTime. And we decided to try and make it happen. And so we started spreading the word. And honestly, the ripple that started was beyond our wildest imaginations. And
Mhm.
the results were tracked by Giving Tuesday headquarters, so the
Mhm.
corporate, through hashtags and through our different campaigns counting. And that first year, we reached 2.5 million acts of kindness from Japan to
Mhm.
Germany to our different ambassadors in the States. And it really showed us the power of kindness. And it's only limited by your imagination. So we had big campaigns that blood drives and going to fire stations. But I think that there's so much beauty in the small acts as well.
Mhm.
And a favorite is Veterans Last Patrol. They look for Christmas cards to veterans in hospice, or leaving quarters at a gumball machine so a child doesn't need to ask their mom, or
Right.
talk messages or hot chocolate drives. I mean, this world could use a lot more kindness. So over the years, it's grown and changed, and we actually learn more from our ambassadors because there's new ideas and
Right.
there's blood, and we really take what's the best out there and try and implement it, or teach our other ambassadors how to scale, how to create the largest impact in their community.
So have you ever heard the term BHAG?
No.
So I'm with Team Red, White, and Blue, Team RWB.
Oh yeah,
Uh,
yeah.
okay, so I've been with them since 2015.
Okay.
Started off with them in Alaska, and I've been with them ever since. And we have the idea of everybody does a BHAG at least once in their life, a big, hairy, audacious goal,
I like that.
right? And it's
Yes.
something that whenever you say it out loud the first time, you're like, this is insane. How am
Yeah.
I going to do this? But you do it one step at a time, and the next thing you know, you've reached your BHAG. So it sounds like
Hmm.
y'all had, you're like, that was y'all's. You're like, we're going to do 1,000,000 acts of kindness. Wait, we're going to do what?
Yes.
Like,
It's
silly,
pretty.
somebody says it, and all y'all go, huh?
And figuring it out, we created this promo video. And behind the scenes, it was 11 o'clock at night. I don't even think I had pants on. Maria grabbed me out of bed and she's like, we need to record this now. That's probably videos that had the highest publicity. Um, it's just, we didn't know how we were going to do it. And we were only successful because we had a team of people who believed in the idea and walked shoulder to shoulder with us across that finish line. It was just on a vision of what we could accomplish. The second and third year, the pitch becomes a lot easier because you have results to present. But that
Right.
first year, I think, is always going to have a special spot because it was based purely off passion
Mhm.
of changing the world.
And that's what's great is it takes one person with an idea
Mhm.
to get one person to believe in the idea.
Yeah.
And then the rest of it just snowballs from there because it does grow organically that way. It doesn't feel forced. It doesn't feel like people are just jumping in because it's transactional. It's something they see the passion and the meaning behind it, and so it's easy to get buy-in that way.
And think of the positives of military community. We touched upon the negatives with, say, military healthcare and stuff, but the positives is military spouses are so connected,
Mhm.
right? I lived in Alaska with this person and now they're living here, and our networking potential, and the fact that we just really don't take no for an answer because we're so used to grit and grace
Right.
that we power through to make things happen. And so if you need to get something done, 100% of the time I put my money on military spouses because they're going to figure it out. There's
Mhm.
probably going to be some duct tape involved. Um,
That's not a probably. That's guaranteed. There's going to be duct tape involved.
Yeah. And we tie in with the first responder communities as well,
Mhm.
police, EMTs, firefighters, because I think that they live a very similar lifestyle of sacrifice,
Mhm.
and they understand really what the families give up as well. So
Mhm.
those are our people.
Oh no, you are not wrong at all. So my wife and I got married in 2004,
Hmm.
and whenever for the first, she didn't join the military till 2010.
Oh,
Yeah,
yeah, because you
everybody gets that. Everybody gives me that response. They're always like, "Wait, what?"
so there was 6 years where you guys were civilians, and
Yep,
then she made a jump.
yep.
How'd that conversation go?
I mean, again, I'm a very easy sell. I'm
Yeah,
so your husband's Army, correct?
yeah,
Okay, so do you know where Fort Polk is?
yeah, Louisiana.
Yeah, so I'm from 30 minutes south of Fort Polk. So I grew up in a very, very military town. So
The local boy? No, because you guys were was she okay, keep going. How is that?
Anyway, so we meet in college, and so I went to school at Northwestern State in Natchitoches, which is about an hour away from Fort Polk.
Mm-hmm.
Matter of fact, there's a NSU campus at Fort Polk, but I went to the actual main campus because I was a band nerd, still a band nerd. I played drumline, and
Ooh,
anyway, so we met while I was in college and got married when I graduated with undergrad. She went back to school, then she went to veterinary school. She went to LSU veterinary school. During her third or fourth year, it all gets a little blurry at this point. She finds out about doing public health, and then she finds out that she can do public health for the military because she never wanted to be the spay neuter vaccinate veterinarian. She wanted to do something different, and she felt this calling to do something bigger than just herself. And she was like, what if I joined the Air Force? And I looked at her crazy, like, what do you mean, what if you join the Air Force? Like, oh, if this is what you want to do it. She said, but it would mean this and this and this. And I was like, I speak Army because all my friends are Army from high school. I'm like, I understand. I'm like, do you understand? We're going to be moving every 2, 3, 4 years. Like, we're not going to be in one place. And she was like, yeah, I think I do. I'm like, if you're good with that, then let's do it. And then
that's
she
incredible.
joined. But but before she joined the Air Force, I was law enforcement. So I was
I did that.
not many people do. Yeah, I was a cop for 8 years.
Okay.
So I was for the first 4 years of her Air Force career while we were at Barksdale in North Louisiana. I was I was a police officer, and then for 4 years of veterinary school, I was a police officer. So when you say that law enforcement, first responders, and military, they get it. We speak the same level of understanding across the board. We really
Uh,
do.
so going back, when you left law enforcement,
Mm-hmm.
how do you feel about that?
How do I feel about leaving law enforcement?
Yeah.
I mean, I miss it. It was the best job I ever had outside of being a stay-at-home parent. But
Mm-hmm.
I I look back to, and I tell my oldest daughter the story all the time. So we didn't have we didn't have kids until Kelly joined the Air Force, and I was working a lot of nights because that's what cops do. We tend to work nights a lot. There was one night I was getting ready to go to work, and my oldest daughter was about, I don't think she was quite a year old, or she may have been right about a year old, but she stood in front of the door crying because she didn't want me to leave because I was working nights so much. I was gone. I was never there for bedtime. Or when I was
Mm-hmm.
home, I was tired and I had to sleep, and she didn't understand while I was sleeping. Like, she wanted me to get up and play. And so those are the things that even now when she's like, well, you could go back to being a cop, I'm like, no, you don't remember this. like I
Yeah.
can't, from once I got out of it and started doing, because we left there and I was a stay-at-home dad for a year. um I couldn't go back to it. It's too much of a stress and strain, and I can't be on that type of schedule and then have Kelly deploy, because then who's going to
Oh,
be home to take care of the kids?
yep, yep, I understand. Mike had looked into several different law enforcement type jobs,
Mm-hmm.
border patrol and sheriffs and things here. And
Mm-hmm.
we have so many friends who are law enforcement and I
Mm-hmm.
love them, but I just couldn't get on board with that. Said, Mike, when you deploy, you go to the bad guys.
Mm-hmm.
If you're law enforcement, the bad guys are here. And
Right.
I don't know. I couldn't say yes to that. I'm used to when he's gone that I need to worry, but when he's home,
Right.
he's safe.
Yeah.
So yeah, he's doing computer stuff now, which is a better fit.
It's a much that is a much more lucrative fit as well. Like the the things that I did not like about being in law enforcement were going to court on my day off, because it never failed. Like they could never schedule you court for the days that you were already at work, and you
Yeah.
could just go. It was always uh the first, like, if for me it ended up being, okay, I'm coming off of a Sunday night shift, have Monday morning court, and then sit in court for 2 hours trying to stay awake, only to find out they pled the case out a week ago. And mind you, I would call the day before. So like if I had court on Monday, I'd call on Friday. Hey, here's the docket number. Is this thing still going to trial? Oh, yep, it's going to trial. Court's at this time. Cool. See you there. Get there, sit there for a few hours. Like, no, we pled this case out a week ago. It's like, I
Mhm.
could be asleep right now.
Yeah. This is why we need to love our law enforcement, because there's so much that goes on below the surface
Mhm.
that they deal with working hard to keep us safe. And I don't think, you know, it's not on our radar.
Yeah, and I know a lot of guys and gals that are law enforcement still from my time back in Louisiana, connections that I've made. There are a lot of really good people out there, just like there's a lot of really good medical providers out there.
Yeah.
And so the percentage of people that are in the profession that don't need to be there versus the people that are there truly trying to make a difference is it's a huge difference. There are so many people out there trying to do the right thing, doing the best they can with the parameters that they're given,
Mhm.
that it's a but yeah, I definitely couldn't go back to it.
No, I mean, even looking forward to what Mike has going on in the next couple of years. Already, we have gymnastics, and my son does cross country, and
Mhm.
I feel like they need me more now that they're older,
Yeah.
where I spend most of my days in the car shuttling, where working becomes really tricky
Yes.
because snow days here or sick
Hmm.
days or school vacations, they age out of daycare, and
Yeah.
I'm certainly leaving my children home alone during the summertime. So there's always that give and take. I feel like you need that one stable person in the
Hmm.
relationship just to make everything else work and to give your spouse the freedom to go do what they need to do.
You're not wrong. It definitely does get tricky. I kind of chuckled to myself when you just said gymnastics, as my youngest does gymnastics.
Yeah.
And so we start they just she made team this year, and they
So
just
did
released.
I just went for the first time yesterday. I was like, ooh, this is serious. They have like
Yeah,
matching books, everything.
oh yeah, the match, the backpacks, the Leos,
Yeah.
the hair bows, the whole nine yards. And then they released the competition schedule, and I was just like, are any of these in Ohio, or are we going out of state for all of them?
Are you coming to New York now?
We're not going to New York. We're doing Kentucky, we're doing Indiana, a couple in Ohio, and then the big meet is actually in Savannah, which was going to be that's going to be a lot of fun, because whenever we lived in Georgia, we went to Savannah 2 or 3 times, and so we really like Savannah.
Were you guys scheduled or stationed at Fort Benning?
No, so we were down at almost at Warner Robins, but no, so at Robins Air Force Base.
Okay.
So we were 90 minutes south of Atlanta,
Mm-hmm.
which so that whole I-70 traffic going to Atlanta, if they could just take that section of highway away,
Yeah.
it would be so much better, because it was just miserable trying to drive through there.
I missed that part. So Mike joined in 2000. So he was
Okay.
a PC guy. And I don't even think it's called Fort Benning anymore. I don't know what it is, but he was there from 2000 to 2004.
Hmm.
And we ended up getting together a week before he came home. He was supposed to be getting out of the military. So I missed that whole Fort Benning time of his life. But I hear the stories of going to Atlanta and Savannah and things like that.
Savannah's gorgeous. It is it's probably one of the prettiest places I've ever been, because of the how much history is there, and how much they've tried to preserve. Like, the fountain that's there is like almost 200 years old, I think. The giant fountains in the middle of the town. So if you ever get the chance to go, I highly recommend it. It's gorgeous.
Maybe I'll have a gymnastics competition down there. Who knows?
Maybe you'll have a gymnastics competition down there. Let's talk about the giving. We already talked about moving the Giving Military Tuesday. Giving Tuesday Military. I signed up for it this year, so I should know exactly how to say it, but
it'll roll off the tongue. You're going to be amazing. This is going to be fun.
It is going to be fun because the area I live is a lot of military families. And so I'm going to start reaching out to them and get some other people involved, because there is strength in numbers.
We have a Facebook group, Brittany Rains and Melissa Johnson. They run the program, and they actually started with having one of the most powerful campaigns in 2020. And so when we saw, what their skills were, we knew that we had to bring them on board, and they have just been phenomenal. So we'll get you tied into the group. We feed you ideas. We can all learn from each other. It'll be really fantastic. November 28th. Yeah.
Yeah. I'm looking forward to it. It's gonna be fun. So what is, to go back to ovarian cancer and your story, what are your plans moving forward? Like what does your recovery look like? I know you say you have one chemo treatment left. So what is your plan looking like going forward?
Full transparency. Currently right now, my blood levels, my white blood cell count is the lowest it's ever been.
Okay.
So it was 1.6 last Friday, which normally I'm in the 3s when that blood is drawn. And my appointment I had this morning was my other blood draw. So these are my pre-chemo labs that I had drawn today. If my values, which they typically continue to fall, and today's my lowest day, if it's less than 1, I'm not eligible for chemo.
Right.
Next, which I bought a tutu. I have a t-shirt that says last day of chemo. It'd be super embarrassing to wear this there and then be like, meh, not today. So I might keep it in a bag and then change in the bathroom just to see how so I have my last chemo. I need to be off chemotherapy for 8 weeks, and then we'll move forward with my double mastectomy in early December timeframe.
Gotcha.
And then, Mike is gone right now, so he's out of the country again. But what I'm trying to communicate with him is that life is never going to go back to the old normal, because I'm not that person. And I'm really trying to navigate, what does my life look like going forward? Doctor's appointments are going to be many. Every 3 months I'm going to be followed, but that's only my oncologist. I also have my pancreatic specialist and the breast people. And so that I'm trying to, what does that look like? What does my professional career look like going forward? I'm really drawn to get into the advocacy space. There's so much knowledge that I think patients don't even know. For example, IV hydration. So I was hospitalized after my first chemotherapy, had allergic reaction, almost died, was carried out on an ambulance, completely unconscious, ended up getting hospitalized again 5 days later for dehydration. So we had to not only tweak my medication, but also now I go for IV fluids 3 days following chemo. A lot of my friends don't even know that that's an option, or that you can request antiemetic medications in your IV fluids to make the experience better, or, ice packs for your hands to decrease the peripheral circulation so you're not having issues with neuropathy. There's these gaps that I think I'm in a unique position to help with. Not that I'm an expert. I haven't practiced in gynecology. Oncology is certainly not my gig, but as a patient, I think I can bring some knowledge to help people going forward. So I'm really trying to shape what that looks like.
Well, and then, like you said, because of your medical experience, and being on the patient side of it, you have that unique aspect of you can speak both languages. When people are going, well, my doctor said this and I have no idea what this means, you can explain it to somebody like me, like, no, this is it simply means this.
Yeah.
And that is a very comforting idea, to have somebody that can speak both languages.
Right? I'm excited about it. I went to my primary last week and he's so fun, but he was like, I was listing off my problems and he's like, listen, you got to tuck away that type A personality you got going on, business plans, and just focus on healing because you've been through a lot. And I was like, all right. But yeah, I have these ideas and I think looking to see how I can help others also gives me a sense of control because there's so
Mhm,
much out of my control right now.
mhm,
My blood levels or the allergic reaction. I just had another allergic reaction last chemo session. Um, so it gives me something that's tangible, right? That I
right.
can handle going forward. And just to recreate my identity. I mean, 5 months ago, I had long blonde hair
Mhm,
and I didn't have all these scars on my body. And I was 30 pounds lighter before the steroids that they have me on to try and stop these allergic reactions. So I don't really recognize myself on the
mhm.
outside. So I'm really trying to recreate and pull out who I am from the inside.
And that growth and that finding your identity is something spouses tend to struggle with anyway.
Yes.
So then trying to do all that and something that you've touched on a couple times that your husband's been deployed multiple times during all of this.
Yeah, he's a busy guy. He was here, he left during my fourth chemo treatment. So he
Mhm,
went to chemo with me and then he left to the airport right after. So I was really nervous about what chemo and recovery looked like,
mhm,
kind of being the military spouse. But the beauty of that is community, right?
mhm.
So one, it's really hard to ask for help.
Yeah.
I had my daughter's friends' parents kind of had a meal train that fed us the entire month of August. And initially,
Mhm.
what do we say as military spouses? I'm good. I
I'm
got it.
good. I got it.
And Instacart, we can
Mhm,
DoorDash. There's chicken nuggets always. But I allowed myself to say yes. Yes, I need some help.
mhm,
And the military community swooped in, the civilian community here swooped in, my family, my sister flew up from Nashville to stay with the week, my parents. There's been so much love funneled our way that August really wasn't as scary as I was prepared for. It was
mhm,
okay. I'm okay. And Mike is coming home soon
mhm.
within a couple days. So he'll be here for my last chemo treatment. And coming out the other side, gosh, I really feel like there's not a lot that I can't do at this point. And that sounds a little arrogant, but
No,
when
it
you
doesn't.
go through accomplishments,
Mhm.
I've been pregnant during deployments. I've had 3 children and working full time during deployments.
Mhm.
If I can answer in deployments, like, man, okay, this this will be okay.
You need to get a Wonder Woman tattoo.
Yes. I don't have any tattoos. Jessica always tries to persuade me to at least get one. So maybe
Like,
that's where I'll cave as the Wonder Woman.
don't do it because they're like Pringles. Once you have
Yeah.
one, I'm telling you. But see, that's the stuff that I really don't think people understand about military spouses is we build these walls because we have to, or we
Mhm.
feel like we have to build these walls of nope, I got it. This is just another thing on the pile to deal with while my spouse is gone. It's fine. Everything's fine.
Yeah.
But by allowing yourself the grace to say yes, then you give
Mhm.
other people the chance to help pour into you and build you up so you're not just having to prop yourself up.
Yeah. And that's hard. I mean, everybody jokes about Murphy, right? Weird things happen when they leave, and
Mhm,
cancer definitely tops that list. But I think also if we can learn to let people love us, it also gives them a sense of power that they're helping with the situation,
mhm,
that I don't have to carry that burden by myself. And in the early days when I thought I was going to die, honestly, that's what it came down to.
mhm,
I never thought about my job, which I like my job. I never thought about the things or the house or anything like that. I thought
mhm,
about my husband and I thought about my kids
mhm,
and I thought about the relationships. And so, if anything, the lesson that I'm trying to take away is letting people know how much I love them appreciating those friendships and the friends who stood by me, because I've been carried by a little army since
Mhm.
April 9th, and just letting people know that I appreciate them and I see them. And hopefully they feel that too.
Mhm.
And I think that in that sense, I'm trying to make the world a little bit better.
So do you feel that you were drawn more to advocacy because so many people poured into you whenever you needed them most, that you want to pour back into others?
Yes. I also feel like I was blindsided by my diagnosis when I probably should have known better. So if it happened to me, it can happen to them. And I'm just trying to save them. Um, Having to have the conversation I had with my children when we told them that I had cancer and we weren't really sure what was going to happen. That was awful. I don't want anybody else to go through that.
Right. But even if that conversation does have to come up, you can be there to be, okay, here's how we did it. Here's how we might have done it differently, you know.
Yeah.
So now you can be that person that speaks both languages
Mm-hmm.
and be that support for somebody else that may not have had it otherwise.
Absolutely. And I'm hoping, because there's power in knowledge,
Mm-hmm.
and my experience can help other people navigate whatever their journey is, or even if it's just snippets.
Mm-hmm.
I think that you can apply the lessons of my cancer to many different things, even different deployments, accepting help and things like that.
Mm-hmm.
Um, yeah, I want to be of service to others so that this journey wasn't in vain. I need it to mean something. I
Right.
need it to have value.
And I was talking with a good friend of mine, um, actually recording a podcast. She and I marched on drumline together in college, and a lot of what she was saying, because she dove headfirst into the military spouse employment advocacy side. That's one of her big things. Um, but just listening to her, and this theme keeps coming up in my head from people that I talk to. It seems like most military spouses that are actually trying to put forth good and do good things with other people. There's an old expression of "leave it better than you found it,"
Yeah.
and I really feel like that theme keeps popping up with the different people I talk to. It's popped up with Maria, it came up with Melissa, and I've got a good friend of mine, Heather, who is phenomenal when it comes to talking about food insecurity and things that families can do to help with that. Yeah, Heather Campbell, absolutely. You probably know her.
I love her. I love her. She's amazing.
Could not agree with you more. We were together in Alaska.
Mhm.
But yeah,
Yeah,
she's an
she's
amazing,
a phenomenal.
amazing. And then listening to you, it's like I wish more people understood that. Yes, military spouses, we tend to put up these walls about that we can do everything ourselves because we kind of have to. When our spouse
Mhm.
goes, we learn how to do plumbing work. We learn how to change light bulbs and replace switches and do minor repairs and figure out where our boundaries are. But we push those boundaries. But then we also want to make sure that our community is taken care of, because
Yeah.
we want to make sure that the people that come in behind us have at minimum a better experience than we had.
So the motto that I use, especially when it comes to Giving Tuesday Military, but you could apply it to really anything, is that I work to create the world that my children already believe exists.
I
Period.
like that.
So they look at the world with goodness, and people are helpers, and we're part of the Wild Keepers. I don't know if you've heard it. We pick up garbage for fun.
Okay.
So we keep a garbage bag in the car for when we go to the playground.
Mm-hmm.
I'm really trying to give my children an opportunity to see the world that it could be. And it
Right.
takes people like you and Heather and Maria and Jessica and Brittany and Melissa and all the people that follow that same mantra. And I
Mm-hmm.
think together we are changing the world, even if it's for one person. You change the world to make a better place, and then they pay it forward.
Yeah. One of the things that came up when I was talking with Melissa was the thing that really opened her eyes to doing things, to doing any sort of advocacy, was She was at a meeting and somebody literally made room at the table for her. There was not a chair for her to sit. They scooted their chair over and pulled up a chair for her so she could have a spot at the table. Like that,
Just, I mean, what that represents right there.
especially when you consider that the person that did that was a 1-star general's spouse. And so here's somebody that most spouses are like, oh, they're over here, I don't need to. She's like, no, you sit here next to me at this table and we're going to do this together.
That's amazing.
Right. And that's literally, so that's like, people use the word literally entirely too much. I know I do, am guilty of it as well, but that's exactly what they did. They didn't figuratively make room at the table. She literally made room at the table for her.
Mm-hmm.
And I feel like that's what a lot of spouses like yourself are doing. You're making room at the table. That way other people can understand that there is room, that we don't have to do stuff by ourselves.
Yeah. I mean, there's I choose collaboration over competition. I like horseshoes instead of circles. There's always room for one more. And when I think at the top, there's enough room for everybody to shine. So I want to help people maximize their potential. And sometimes you just need somebody to advocate or fight for you. Last month, I bought a new fridge. We got it delivered on July 12th. I had chemo on July 11th. Mike was getting ready to leave and the alarm went off. So the door alarm, and it would beep every 7 seconds, 3 beeps for 4 weeks, right?
Oof.
I was about to lose my mind, still going through chemo, and I just needed somebody to handle it. And it couldn't be me I could hand with. And I have this beautiful friend, Angie, and she said, I'll take care of this for you. She navigated Lowe's. She did all the footwork for me, and she ended up getting me a new fridge. And what that represented is hopefully what I can do for other people is sometimes you just need somebody to fight for you and just to handle and to take that off your plate. And I think Angie's not a military spouse. She actually went to PA school with me, but that sweetness, she didn't have to, but she did. And that made, and I just think about that when you don't have to, but you do, how does that affect the person that you're helping? It could totally change their world.
No, you're not wrong. And it's whenever you do something for somebody and you're not asking them, you're like, no, I'm doing this thing. Because I'm sure you're a lot like me, where if somebody says, hey, do you mind if I do this for you? Your knee-jerk reaction is, no, I got it. Yeah. Thank you, but I got it.
Really, aren't we? Like, we need to take a poll at how many of us are like, nah, I got it, I'm fine.
It's
Man.
so I just ordered shirts for the podcast, and the back says military spouse motto, it's fine, everything's fine.
Yes. You have merch?
It's coming. It's coming.
I'm very excited about
this. It's on the way. I have put this off a very long time because, again, talking about, I never felt that I was worthy of having merch, but I was like, why not? And so I found this really cool company. It's that self-deprivation that I fight with daily of, why am I doing this? There's other people that are better, but why not me? Not everybody's going to get a conversation out of somebody the same way that I can. Not everybody wants to have the same conversations I want to have, because I'm sure whenever Maria connected you, you're like, oh, cool, somebody that wants to talk about ovarian cancer. Wait, it's a guy? Like, I guarantee that thought crossed your mind at least once. Like, what? Oh, I mean, okay.
You are a pleasant unicorn.
Well, thanks. That's part of us being a male spouse in general, I think. If people are like, oh my God, they exist.
Yes.
But it, so I found this really awesome company. And the funny thing is, the name of the company is The Awesome Company. They only employ people that are on the autism spectrum.
Really?
All of their designers, all of the people that work the presses, their whole facility is run by people on the autism spectrum. And so
That's phenomenal. I'll
I
have to
found out about this, and I was like, I need this. This is who's going to do my merchandise.
Mhm.
So yeah, so I actually sent an email back to them this morning about moving forward with the next step. So yeah, you're the second person that I've told. Maria was the first.
So t-shirts and hats and water bottles and
uh,
decals.
right now, probably just shirts and stickers.
Okay. I
That's
like it.
the yeah. My wife said if I do anything, I had to do stickers because she likes stickers.
Mhm.
So anyway, so that's coming. But yeah, that's our motto though, right? Like everything's on fire around us,
Yes.
and we're just like, it's fine. And I don't think enough people understand that about military spouses. Like, we're going to figure out a way through it.
Mhm.
It's guaranteed there's going to be duct tape on it. It's guaranteed there's going to be a few pieces missing, but we're
Yeah.
getting to the other side of it.
We're getting to the other side. Do you have a core group of friends that carry you, that you vent to or help strategize where you're going to hide the body or what needs to be done?
Uh, the people that the people that know where that body is going to be hit, or they're very they're there.
Mhm.
But you know, I've got be most of my core group is really my wife and just a couple of other people, because not everybody's going to see your vision.
Yeah.
And so whenever I first started talking about doing this podcast, a couple of people were like, "Oh, that's cool," but everybody else is like, "Why?"
And you have to protect that energy. You
Yes.
have to keep that group tight because it's so much easier for people to pull you down to their
Mhm.
level than to help push you up. I experienced that when I went to PA school. So I didn't go
Yeah.
to PA school until I was 30.
Okay.
We lived in West Virginia. I moved out of our house
Mhm.
to get an apartment in Kentucky, and my husband took care of our son for 2.5 years. I came home on weekends, but
Mhm.
when you have a mother leaving her son to go to school,
Leaving.
that doesn't go over very well.
Yeah.
So there was a lot of negative energy in the beginning, but I graduated as an honor grad.
Mhm.
Of course, I moved back home. Everything's fine. We had 2 more babies, but it's what I needed to do at that time. It just wasn't
Mhm.
a popular.
But not everybody can see your vision.
Mm-mm.
And I'm
My
sure
husband,
it's well, and that's yeah. Otherwise, if your husband would have been like, "I don't think it's a good idea,"
yeah,
you know, that would have been different. But your husband sounds like an amazing, incredibly supportive person. So
he's pretty awesome.
whenever you're like, "Hey, I want to go do this,"
Mm-hmm.
I'm sure it wasn't a hard sell.
No, I mean, we're Team Gamokes. So, he's been kind of since 2004 when we started dating, knew that that's the trajectory I wanted to get to. And I had initially taken all my prereqs when we lived in North Carolina, thinking we were going to move to Colorado to go to 10th group. And at the last minute, orders changed and we ended up in West Virginia, and none of my prereqs lined up. So starting from scratch.
Right.
So I started that building process all over again.
Yeah. And then, like you were saying, like then you have that core group that's like, "No, you can do this," and it makes that decision a lot easier. But again, not everybody's going to see your vision. You saw what your vision is, and now I'm sitting here looking at it, I'm like, this totally makes sense that you went to PA school in your 30s, because you went to PA school a little bit later than most people, but then you have this experience of going
Mm-hmm.
through what, let's just face it, is one of the worst things medically that can happen to a person.
Yeah.
And now you have this unique ability on the backside of this to go forward and help other people.
Mm-hmm.
So it's exactly the way it was supposed to work out.
Which is wild when you kind of sit back and think about it. And the thought I had when I was mowing the lawn the other day is, what if my draw to medicine is to help other people, but what if the purpose originally was to give me the knowledge to save myself?
Yeah.
I it took me a hot minute to get there, but when the symptoms became bad and when I felt
Mhm.
the mass and being able to navigate the system, um, I don't know. It's a rabbit hole you can go down. Kind of. I've got 17 acres to mow, so I have a lot of time to think. It gets real deep out there.
Hey, you know what? It I'm a power lifter, and I know whenever I get in the gym and start going, my brain, I go all over the place with stuff. So I can imagine mowing 17 acres. You're like, what about this? What about this? And what about this? It's just it
Yeah.
that is that's it really it really is interesting how everything just seems to work out the way, not the way we want it to, but the way it needs to.
Hmm. And I think my responsibility now is really taking that second chance at life
Hmm.
and making sure that I value those moments, and that I've been trying to communicate to Mike. I keep sending him like new things on my bucket list because I
Hmm.
have this insatiable appetite to live.
Hmm.
I don't want to exist. I want to live.
Yeah.
And it doesn't always have to be big things. I said, take me to Tuscany. But I
Hmm.
also said, there's a restaurant down the road that we've been going to for years that has an apple pancake. And this apple pancake on the menu says it takes 45 minutes to prepare. So you have to
Hmm.
come with your. And when we go, I'm starving or we have the
Yep.
kids, don't have the time. Why have I not had that apple pancake? So
Hmm.
when he comes home, I'm getting that pancake. And we're doing the things and we're apple picking and eventually we'll go to Tuscany. But um, I think time is a lot shorter than we actually realize. And so
Hmm.
I can't let that wake up call go to waste. I have to
Right.
live. I have to experience what I need to, because at some point I may not be here. I hope I
Right.
am, but statistics are kind of crap. So it gives me this urgency.
And there's another quote that I heard. It's like everybody's born to live, but not everybody. Oh crap! What was it? It's like basically everybody lives this life, not everybody experiences it.
Yeah.
Like really, when you really get down to it, and so many people go through life simply existing, going through the motions day in and day out. It truly is sad, and it's something that I didn't really understand until probably the last couple of years,
Mm-hmm.
because you know as I'm also in my 40s, and I start thinking, okay, I've only got X number of years left with my kids when they're little.
Mm-hmm.
Do I want to just be here and shuttle them back and forth, or do we want to experience everything together? Like, do we want to go out and do different things, or do we just want to stay home all the time?
Yeah. So 2 weeks ago, I don't know if you saw, I did a post on Instagram. I was 4 days out of chemo. It was a
Hmm.
Saturday, and I was like, let's sleep outside tonight. Let's pitch the tents. So we put the tents up in the backyard,
Hmm.
and I just needed to make memories. I needed their summer
Hmm.
to be worth something. And my fire building skills stink. I couldn't get a fire going. Mike makes it look a lot easier than it is. But we laughed and we had
Right.
s'mores, and we just spend time together. And so I'm trying to plant those experiences so that when my kids look back, they
Hmm.
think about those days, or they think about when we went apple picking, or we did a hiking challenge last winter. It was the best winter, hands down. We can't wait to
Hmm.
do it again this winter. Just to be intentional. I think that's
Right.
the takeaway. Be intentional about life.
Yes.
Mm-hmm.
Absolutely. Um, Man, I keep. This is probably one of the bad things about me is I tend to not write down notes before an interview, because I really just love where different things go. But my head's in like 15 different directions right now because you keep saying so much good stuff. I'm like, yeah, that. Oh wait, that. Like you were talking about the IV fluid treatment earlier, and like the first thing that popped into my head was one group that knows a lot about using IVs to rehydrate themselves is powerlifters,
Oh.
because powerlifters, if they, depending on what federation they lift in, a lot of them will cut water weight to get to a certain weight class.
Mm-hmm.
And then if they have a 24-hour if there's 24 hours between weigh in and competition day, they'll make weight that morning and they'll go straight to one of those IV places,
Yeah.
and
Those are
they'll
mm-hmm.
get like 2 bags of fluid and with vitamins and all kinds of other stuff in it to recomp for the next day. But that was the first thing that popped in my head. I was like, oh, powerlifters have been doing this forever.
Yeah.
But it's just making memories, being intentional is something that I think more people need to be aware of. And that is something that you are in a very unique position to do, because not very many people have stared their own mortality in the face and come through and been like, no, now I want to make sure that I do these things. And I think that's one of the beautiful things about what your advocacy is going to look like, is that you're able to tell people, no, I've been there. And this is what it looks like on the other side.
And I have so many conversations I want to have with my husband. He just hasn't been home to have them yet. I'd love to hear what his thoughts are from the military side of things, right?
Mm-hmm.
Because our servicemen, and even in law enforcement or our first responders, I'm sure that there's been instances where they've faced their own mortality,
Mm-hmm.
and they have to keep on living because that's just part of their job. Like
Mm-hmm.
mine was a shock because it came out of nowhere, but Mike's been in that position for the past 23 years. And
Mm-hmm.
we've never talked about that. We've never talked about how does he process that? How does that translate into who he is and what he wants to accomplish? Where I've just kind of been, I don't know, I don't think of my husband as a super awesome soldier. I mean, he is, but when I see him, he's Papa Mokes when he's home.
Right.
So he sings and he dances and he giggles and he plays
Mm-hmm.
with the kids. I don't see that warrior side of him,
Mm-hmm.
which I know exists. But I think there's so many conversations to talk about, and our servicemen and women could maybe even help. I mean, they're helping me as a cancer survivor now. I'm saying I'm a survivor because I'm going to win this, but it's just so interesting. There's a lot to really unpack there, is that this population of people face their mortality and keep living. And that's such a beautiful lesson for me now.
So, and I know I would be interested to hear that from the people that are doing it well, and not
Mhm.
masking and just burying the other side of it.
Yeah.
Because
Yes.
I know whenever I was coming up in law enforcement, it was, oh, that was a really tough call, put it in a box, bury it in the drawer, deal with it later.
Yeah.
That's what we were taught. We were not being facing emotions as a first responder was not something that was promoted or encouraged.
Well, I think, seeing the suicide numbers, there's been a shift towards speaking about mental
Mm-hmm.
health and raising awareness. I don't think that the services are up to par yet to actually handle that beast.
Mm-hmm.
There's a long way to go. But this conversation, what you're hearing from me is I still need counseling. Like there's a
Yeah.
lot of trauma based in my diagnosis and
Mm-hmm.
even my reaction to the first when we thought I was going to die during my first chemo. I had a rapid response, lost consciousness, like the whole bit.
Mm-hmm.
There's been a lot of instances during my treatment that have just been trauma. My port
Yeah.
eroded through my 4 weeks ago and I started
Mm-hmm.
bleeding at dinner. I haven't dealt with that at all
Mm-hmm.
because one, I'm solo parenting now. Mike's
Right.
gone. I'm focusing on treatment. I'm focusing on just getting through.
Mm-hmm.
And then, right? There's always that and
And
then.
then, yeah.
So I don't know, your listeners may be like, that girl is crazy. She needs some help. And honestly, I probably do. So that's something that I'm going to work on.
But you're also admitting that that's coming.
Yeah.
So you're not burying it to just bury it. You're like, no, I am not able to fully give myself time to heal at this time
Mm-hmm.
because of everything you just mentioned. Because your spouse is gone, you're still going through treatment. I will agree with you. I'm going to call you a survivor too, because I know you want to come through it. So you're admitting that when that time comes, I've already gone through all the other stuff. Now I'm going to be brave enough to do the next step,
Yeah.
which is that mental and emotional healing that you're going to need.
And I think that healing is just as important as healing from a hysterectomy, or even more so, because I need to be in a position where when I practice medicine again, I have to practice it from a place of being unbiased.
Mm-hmm.
And I can't work from a place of fear. I can't order an abdominal ultrasound on every single patient I have.
Right.
That's not good. So I have to be healed enough to make rational decisions when it comes to patient care. I'm not there yet.
And that's something that not a lot of people are brave enough to admit, though. They want to be, people want to put on that face and that mask and say, no, I can do this, when they really can't,
Mm-hmm.
because they're not there physically, mentally, or emotionally. They're looking at it through that one lens of, oh my God, I don't want anybody to experience this, so everybody's going to get everything done.
Yeah.
When, like you just said, that's not always the answer.
And also now, from the patient side of things, I see how a diagnosis can either save your life or condemn you. So if you miss something, it's real people, it's real lives at stake. There's real consequences to that. So there's a lot of pressure that I'm putting on myself now to make sure that I get it right. And you do the best to your ability, but it's a big cost. There's some high stakes at play.
It is, and that is something that, again, you're already admitting that now, so you'll be able to work through that later, and hopefully be able to give yourself a little bit of grace, because I know people say it all the time, but we're just human.
Yeah.
And part of that, what I think some people miss, is when they say, well, I'm just human, it doesn't make you immune from mistakes, but it also means that you should be able to give yourself a little bit of grace, where if you did the best you could, then give yourself a little bit of grace to be like, I did what I could with what I had.
Yeah.
And kind of not necessarily forgive yourself, but be okay with it moving forward, which is not always easy.
It's not easy. That's a really hard journey to process, and to get to a point where you can have that self-forgiveness.
Well, self-forgiveness
This
isn't
is
easy.
deep.
I mean,
so you see me selling foot pick, you know that the self-forgiveness thing didn't work out.
oh man.
Yeah.
Well, it's not easy. It's something that everybody can work on. Lord knows I'm sitting here saying it, and I just got done saying how I'm like one of the worst people about talking about bad about myself. So it's not always the easy thing.
I'm gonna buy your t-shirt.
Well, once I get this store set up, I'll have the link up, and we'll go from there.
Perfect.
Something else that you did recently, you were talking about mowing grass, is you went for a run.
Yeah. Yeah. So after chemo number 3, and a lot of the weight, I knew I was going to lose my hair. I knew I would have scars. I did not anticipate the weight gain. And I don't want it to be about weight. It's not about a number. It's more on how I don't recognize my body. I feel like my body's not my own right now. And I have been healthy in the past, physically active in the past. And I just kind of got mad. So I joined the gym after my 3rd chemo treatment, and I would just walk on the treadmill. And then I just haven't been up to it in the past 2 chemos. So what is it, Sunday? We were talking about living in West Virginia. I used to have this 5-mile loop. There was farmers fields, and the sun would hit you in the face. And I had my chocolate lab, and we were running buddies. Like, I had muscles. It was great. My children did not know I was a runner, and I always identify as a runner. And it kind of made me pause and think about it. And I don't run when Mike is deployed, because I'm always afraid if something happened at the house, I couldn't get back, unless my leg carried me. And it just fell to the wayside. And so it was that attempt to really get my identity back. So I did a loop around the perimeter of our land, and I set my timer on my phone for 30 minutes, and it was hard. I couldn't walk for like 3 days afterwards. But again, it's about being intentional, right? I self-identify as a runner. It's important to me. I want to start doing it again. So as my body allows, I'm going to keep pushing it. And then get to a point where Mike and I have been counting down to September 17th. So September 17th, I should be done with my side effects from chemo. And that's like the launch day. That's where we start Project Rebuild, where we get back to who I was. Sam 2.0 though. And so it's just keeping that fight, keeping moving, not letting cancer win in the sense that I can't spend every day on the couch when my feet hurt, or I have neuropathy now, which is new and a total pain in the butt. Just really trying to always come out on top. And it's not pretty. Like I post pictures on Instagram and there's so much behind the scenes of
Right.
the sweating and the tears and the trying to build yourself up. But yeah, I'm going to keep going. I'm going to keep going and doing it.
You know, there's a guy I follow on social media, and he's a coach in a group that I was in for a while, and him and I've kind of stayed in contact. But he was asked the question on another podcast about how does he want to be remembered, and his answer has resonated with me, and I think you'll see this too. He said he wanted to be remembered with a lot of commas. And what that means is you're not just one thing.
Mm-hmm.
So you're not just a former runner, you are a runner. You're not just a mom, you're a mom, you're a PA, you're a cancer survivor, you're all of these things. And I think people they get hung up and be like, no, this one thing is what I am. Like you're not just a military spouse.
Right.
You're all of these other things too. And to realize how awesome that is.
Do you know Brittany Bacher?
I do not.
Discovering, you should meet her. So she has a program to Discover Your Spark, and that plays so well in what she does, because my experience, you know, back in 2009, I was a stay-at-home mom. This was before PA school.
Mm-hmm.
I lost my identity. I was Michael's wife and I was Mikey's mom. But who was Sam? Like, who was I? And that's where the drive to PA school with. And what Brittany does is she finds out what the commas are in your life and helps you realize who are you and define you. And you're not just a military spouse. You're a military spouse, but you're also you're a mother, you're a friend, you're a Christian, or you're a person of faith, or whatever, and helps you realize those goals. She would be great for you to talk to. She's a phenomenal human being.
That sounds awesome, because I mean, ever since I heard that from Hansei about being remembered with a bunch of commas, like it really, like, it kind of changed my outlook on things a little bit. About, you don't have to be wrapped up in just one thing. And like you were talking about rediscovering rediscovering yourself, and like being like Samantha 2.0. And it's like, Samantha 2.0 is going to be awesome because you're realizing all of these things that you are, and all of these things that you've built through has completely changed who you are today versus who you were 2 years ago.
Well, Maria, the Dash. Did you hear the poem The Dash? She's like, Sam, you pass your death date every year and you don't even know what it is. What counts is the dash. And then another friend said home. But if we combine our commas and dashes, we're going to be unstoppable.
Absolutely.
Yeah.
Absolutely. Because I'd really be curious what the version of you from 2 years ago would be, or what you could even say to yourself from 2 years ago, whenever yourself from 2 years ago is like, oh, we got this and this and this. Is like, you have no idea the forge you're about to go through.
Yeah.
And it's awesome.
And I think life prepares you, but there's a lot of growth, right? So when you're first a military spouse, Mike was gone for 17 days, right? I thought I was going to die. I was in an apartment by myself. I didn't have any friends. There's no way I could do this. And now 20 years into this game, I look at 17 days, I'm like, ha, 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 because I've grown.
Right.
I am now able to look at what used to be a challenge, and it's not really hard anymore. And I think the same thing about who I was 2 years ago. Those life experiences and cancer has given me patience, and it's made me more attentive to my children, and really to be present in the moment and to be intentional. So yeah, we just keep evolving, being forged by fire.
Yes, absolutely. Man, this has been amazing.
It's been fun. This has been a good way to spend my.
This has been so amazing. I'm really looking forward to other people hearing your story, and I'm very much looking forward to continue following your story, because it is truly a trial by fire, and you're just like out in front, just kicking butt, and like, nope, nope, you're not going to get me. I got this. And like you said, I know it's not easy. I know there, but like you said, behind the highlight reel, there is a lot of things going on that you are
Mhm.
going through and that you're handling. But to hear your outlook, it's so infectious and it is so encouraging that I cannot wait to see what comes next.
I appreciate that kindness. Yeah, we've got some work to do.
Got some work to do, but I've
Got some,
full confidence that you're up to the challenge.
yeah. And now, since you're in GTM, we're going to be buddies for life. So this is only the beginning, my friends.
Right on. Yeah, I'm looking forward to it. I need to go back and double check to make sure I signed up correctly, because I have a tendency to think I did something and then like realize I didn't click a button. So I want to go back and make sure I actually signed up the right way.
Okay.
But if you want, where can people follow your story and see what's going on?
I mean, Instagram, Mama Mokes, Inspire Up if they're interested in joining Giving Tuesday Military, inspireupfoundation.org. I think my settings are private on Facebook, so probably Instagram would be the best.
Yeah, well, I like wherever people can, like, that's what I say, like, if you want, because like I've got one friend that she only wants people to follow her on LinkedIn. So
Mhm.
yeah, so it's so Instagram.
So I'm like 42, and I
Mhm.
recognize now that I used to be savvy, and now I'm just middle-aged and crusty. Like, I think I have like 5 friends on LinkedIn. I don't even think you
Uh-huh.
call them friends. I don't understand Snapchat. I don't do the Twitter X. Like, I'm old. So I do Instagram and Facebook.
Right. That's like those are the first two that we had. So that's what we
Yeah.
stick with. Like we had MySpace. People younger than us messed up MySpace, and
Hmm.
it went away. Um, but yeah, so like the only reason why I try to stay up on social media is because I don't want my girls to get on something and me not know what it is.
True story.
That
Yes.
is so because of my, and I think that's because of my background in law enforcement and the things that I've studied through Homeland Security and stuff. I'm like, no, like my 10-year-old is like, well, why can't I have social media? I'm like, because no, like there's like the
Yeah.
internet is not a good place to be for a very naive child. Like, no.
Yeah.
So
Hmm.
anyway, I have really enjoyed this, Samantha. So thank you so much for agreeing to do this and have a, what potentially could have been a very uncomfortable conversation for not knowing me, but thanks for being brave enough to come on and having this conversation with me. I truly appreciate it. And I'm going to change my release schedule to make sure we get this out next week. So,
Awesome.
because I want this to come out during the Ovarian Cancer Awareness Month, because I think the story needs to be heard, and this is the perfect time to tell it.
I can send you some of the information from the NOCC if you have just static images with the symptoms, where you can just kind of put it even on your Instagram story or whatever on the release date so that
Yeah,
people can see.
absolutely. Yeah, I will take whatever you want to send me, and I'll put information in the show notes. I'll put your stuff in the show notes, and we'll get this out and get some people educated.
I appreciate you. Thank you, friend.
No, thank you, and I'm looking forward to, like I said, looking forward to staying connected and watching your journey. But you have a fantastic day. Rest up. I want to hear about. I want to make message me whenever you do your final chemo day, because I'll be want to cheers with you.
It's, well, hopefully Tuesday. I'll know tomorrow with my lab results.
Right
So if you
on.
see a teal tutu on Instagram, I did good.
Right on.
Right.
I'm looking forward. It's
Awesome.
happening. Well, you have a
Awesome.
fantastic day, Samantha. This has been
Thank
great, and we'll chat again soon.
you. Okay. Bye.
Bye.